Devon, why does the Fast ForWord product work so well when dealing with auditory processing disorder?
Well, the first consideration that we make when we're evaluating the efficacy of any program is, has it come out of research? And the Fast ForWord program came out of over 30 years of neuroscience before it was developed. And since that time, it's now been 14 years since the prototype of Fast ForWord was developed. It's had many innovations, many improvements. Now there are 11 Fast ForWord programs encompassing a huge number of skills, including intensive training for those children with auditory processing disorder.
So after that many years of research and now this many years of it actually being used, have we seen any results that are worth talking about?
There are over 200 studies being done into the Fast ForWord programs, and with amazing results in some of those studies. Even studies looking with neuroimaging, looking at brains of students pre and post the program and seeing the actual physical changes we've made in brains to students with language and reading disorder. So we can actually measure brain change after the program.
So after this many years of working with learning difficulties, why did you choose Fast ForWord over the other products?
Well, number one, because it has come out of many years of very well conducted neuroscience. And two, because the Fast ForWord programs simultaneously develop so many skills. So they develop all manner of language skills, including auditory discrimination, vocabulary building, grammar, syntax, morphology, every aspect of oral language, and also written language now, reading and spelling, sequencing skills. But in addition to that, the Fast ForWord programs also intensively train cognitive skills, so they're very much increasing the child's memory, attention, sequencing and processing. And there are very few programs, or there are no other programs that I know of that simultaneously incorporate all of those skills, the development of all of those skills.
So if a child has auditory processing disorder, the program's not specifically written for that, but it can be used to treat that?
Absolutely, because the Fast ForWord program intensively trains aspects of auditory processing, particularly auditory discrimination, auditory memory, following instructions, receptive language, and those skills are intensively trained 5 days a week for 8 to 12 weeks. And at the end of that time, we can actually now see that we've rewired the brains of those students in those areas. So not only has the research shown that we can achieve physical changes in the brain, improved wiring of the brain, but also we can prove with post-testing that we've improved the function of the child. So their oral language improves, their comprehension, their auditory processing improves, and so there's lots of research to show that.
Devon, thanks for your time.
My pleasure.